Okay, I'm going to call that 1.me, 1.zoom, and it's a draw for the day. So welcome everyone. Thank you all for being here. I hope everyone was able to get some relaxation in, maybe some connecting with others, maybe hiding away from others and recharging over this long weekend. I know I have some people out. So as I said, we've got recording going. We'll send this out with notes and PowerPoint. So I'm gonna share screen. And oops, are you all seeing my slides? All right, that's 2 Carmen, 1 Zoom. So we're going to kick off today with just greetings and some good news. I'm actually going to have you wait to put your names and where you're coming from into the chat box until we have a guest coming today from OHA. So when Rachel gets here, we'll do that so that she can see them all because she won't be able to see what's in the chat prior to her joining. But good to see everyone. And we're going to go through greetings and good news. John has an Inclusive Partners quick update for us. We'll do a little bit of follow-up on the Early Learning Council presentations last week. And then, as I said, Rachel Burden from OHA is going to join us and give us a quick review of the new CCO social emotional metric, the incentive. And then we have been invited, the hub directors have been invited to join a learning collaborative that the CCOs have every month to talk with them about what kind of community engagement we would like to see and might be able to offer in partnership to them. So we'll have a chance to talk about that and what that might look like and kind of frame up that conversation with Rachel as well. So. Great. Does anyone have some good news that they would like to share with us today about what's going on out there in your work? Success stories or highlights?
This is Kelly. I can tell you something that I'm looking forward to this week. I'm not sure if you can hear me. Yeah.
We hear you.
Okay. So on Thursday, so today's Tuesday, Thursday, I'm going to the very small community of Adrian, who has a group of parents who want to have a preschool attached to their school. So it's just pretty sweet to have someone reach out and invite us to have that conversation with a group of parents. That's easy.
That is really exciting. Erin.
I have a celebration because I don't think she wants to come over.
No,
This is Laura. She's my new counterpart. So we have someone hired.
Welcome, Laura. We're glad to have you. And I see Renee put in the chat box that you might be fully staffed soon. That is also cause for celebration and excitement.
Indeed. Woohoo.
Yeah, that feels really good. Anyone else have one they want to share?
Hi, Carmen. This is Sue Miller, and I apologize for jumping on a little bit late, but my good news is just that last week's council meeting was fabulous, largely due to 3 of your wonderful executive directors, Kelly, Christy, and Sarah, for the presentations that they and their colleagues made on some of the programs they're overseeing, coordinating, pulling together, launching, etc., in their own regions. So I've had great feedback from other council members saying thank you very, very much for pulling those presentations together. And their sort of hanging question is, how do we support other hubs in trying to do similarly innovative projects in their own region. So just sharing that information. But I'm guessing that's something that Carmen and other staff think about a lot. So thank you again, Kelly, Sarah, and Christy. You were awesome.
Yeah, agreed. Those were great presentations, and it was really exciting to see just the engagement and offer of like further support and wanting to have further conversation about those projects and that type of project overall by the council members. So we will certainly be coming back to that many times. Sarah in the chat says recruitment for our first childcare accelerator cohort began, and we have a ton of interest. Amazing. I'm very excited about that too. I had something fun happen recently. I got to meet Brenda Comini in person for the first time 2 weeks ago. So that was, it feels really nice to actually have those in-person connections and get caught up. And yeah, so that was fun for me. And I'm looking forward to getting around the state in person more in the near future and getting to connect up with all of you in real life or out in the wild, as I've started calling it. All right, thanks for sharing, everyone. And all right, I'm gonna pass it off to John here. As you all know, but John, before you talk about inclusive partners, I'm gonna embarrass you. Sorry, you can like hide if you want to. John does not like to be called up publicly, but congratulations are in order. Last week, John's promotion to professional learning director went through officially. And that is very exciting. As you all know, the community systems team is essentially splitting into two and then building out on both sides. And we've been functioning both as one team and as two teams all together for several months now. And this is just one step along the way in Delk, and we're all really excited to have him leading that team and excited to see where things go. But so as part of that split and build out, the Inclusive Partners team will be coming over from DHS and joining John, and he's going to give us just a bit of an update about that.
Yeah, thanks for that, Carmen. And I'll just apologize to everybody. I'm still getting over a little bit of the after effects of COVID, which wasn't really bad overall, except for the cough that likes to come up as soon as I want to talk publicly. So I will do my best to not cough on video and recording today. But nice to see you all today, and thanks, Carmen, for giving that overview. I could have gone a couple of years without anybody knowing, but I appreciate it. That was kind. So as I am just giving a bit of an update here, it's pretty exciting as we're building out some of the team structures as we move towards the Department of Early Learning and Care, but we found a real important opportunity to, in essence, do a bit of a test run with moving inclusive partners from ODHS over to the Early Learning Division about a year prior to all of the rest of the transition. So we kind of got to take a small team and do, it's not a pilot because it was an actual thing, but we got to do the transition a little early and work out some of the bugs and see how this goes as we're thinking about larger system transitions. But as of Friday, so July 1st, the Inclusive Partners team is officially Early Learning Division team members now. And so there's, for those of you who know a little bit about Inclusive Partners, I just wanted to quickly say for those who may be a little bit less aware, that the Inclusive Partners program is truly where their whole approach. They're a statewide program, but they're 5 people strong doing statewide work. They support inclusive practices in childcare settings and are supporting children with disabilities, and then other children that maybe families that are seeking to get supports for their children who may not already be identified with disabilities can also work with inclusive partners, but they work very closely with childcare providers that are actually trying to attain additional accommodations for children, and they work with childcare providers in supporting children birth, so 6 weeks of age, actually up to age 17. They provide technical assistance and consultation, usually one-on-one consultation with providers. They do professional development. A lot of times those trainings are in partnership with Child Care Resource and Referral. And they also conduct, and this is the really important part about that statewide component that they conduct the high needs assessments so that childcare programs that have children that have additional needs than what the special needs rate through employment related daycare provides, the high needs assessment helps them get access to the high needs rate, which is a higher financial assistance rate that supports inclusion and keeping children in those childcare environments and keeping them consistently in those environments so they're not moving from one program to another. So that's the overview. But on Friday, as Carmen said about going out into the wild, I went all the way to Portland, and I visited the 5 staff as they were receiving their new ELD computer equipment, email addresses, and cell phones. And so there is some changeover here, right? So as you are, or if you know childcare providers or other community members that are reaching out to work with inclusive partners, if they email their DHS emails, those will forward to their new ELD emails. But if they're calling the former cell phone numbers that those inclusive partner staff have, those will eventually go away, but they have new phone numbers that we'll be getting out to everyone so that you know. That the good news is, though, their 800 number and their landlines, which people still use landlines, by the way, it's rare, but they have them. Those are still consistent numbers, so those will remain the same. And hopefully also, I think they have those numbers forward on to those new cell phone numbers. So there shouldn't be much of a blip there. But I wanted to make sure that if you do hear anything, especially in the next week or so, like if somebody has attempted to contact inclusive partners and hasn't gotten an email back or hasn't gotten a call back, that you alert me or Melinda Benson, who's the primary team member on that inclusive partners team, so that we can make sure that it hasn't fallen through the cracks somewhere, because there has been a couple of instances where a staff person transitioned and that phone number was the one that the provider was using to contact, and calls didn't get through as timely as we wanted to. We're already traversing things because they have access to their old email and their new. We're seeing which things land somewhere and don't forward, and which things are forwarding fluidly. But the great news is they're on board. There's been very few little glitches. Today is, coming back from a 3-day weekend, and they're online and they're working, and they've already jumped in, and you'll actually start to see now. It's been happening for the last, I think, few months, but the inclusive partners team has been back doing in-person assessments for those high needs rates, and the staff are headed out this week in their new role as ELD employees, doing the same great work that they were doing before. And I will mention that their home base, their office, is still at the ODHS branch at Gleason and 122nd. So they're still in Portland at that DHS location. It just made more sense in the short term to try and just keep an agreement with DHS so that wasn't an additional transition. And we're still working on what our Portland office space will look like, and how they may or may not be able to access one of the early learning division sites in the future. Websites and that sort of information we're still working on. That'll be updated soon. We were waiting on those new phone numbers and things for the inclusive partners team to have access to, and so they've got those, but they're joining our professional learning well, they've joined our professional learning team as we're building that out. And so as I see people say, you know, we're getting up to fully staffed, I don't want to talk too much about being fully staffed because Carmen has multiple open positions she's trying to fill. But I'm really close. I've only got like one more position to fill with our team. But so inclusive partners and our professional learning work, you know, we're working on the coaching systems development and also other professional development opportunities throughout the state, in addition to developing the suspension and expulsion prevention program and the mental health consultation supports that'll be coming soon with that. So this rounds out our team, and then we'll continue to support Carmen so she can get her other positions filled. And then you'll start to hear more about the transition between our two teams and how we're dividing up the work. But I think that's the overview. If anybody has any questions, would love to.
John, there's a question in the chat box. Thank you for that.
I don't read.
I know, that's why I'm going to read it to you. Begonia asks, can you review for us what languages or how language support happens for providers who speak a language other than English with inclusive partners?
They have staff that speak Spanish, so that support is within the team. They utilize language line support for other languages than English or Spanish. I don't think any of the other staff speak additional languages. And so they'll, when they're working with providers, they either bring interpreters or bring or partner with CCR&R staff in their regions as they're doing supports to different providers throughout the state. But I hope that answers your question.
So essentially they will provide assistance via interpretation or bilingual staff for any language that is needed, correct?
Yes.
Okay, great. And then, let's see, Begonia, you asked, are they going to be able to provide inclusion best practice cohorts for providers? So will they be doing direct training, John, in the field outside of their normal training?
So they are doing direct training in the field and have different types of professional development opportunities, but the question around cohorts and inclusion best practice, that sounds to me like, Begonia, you might be asking if they'll do like longer term engagements with providers in groups. Is that?
That is correct.
We have not gotten to a place of deciding how they might do that. One of the things that we're really excited about having inclusive partners at the division, I'll back up just one step. Inclusive partners, for most of the years that they've been in existence, have been fully funded by Child Care Development Block Grant funding, which is funding that comes through the Early Learning Division and up until recently has been subcontracted to or contracted to DHS. And so it makes a lot of sense that since they're fully funded by child care dollars, that they exist within the Early Learning Division. And so the long-winded answer to your question, Begonia, is now we have the opportunity to start assessing like what would be best practice in supporting inclusion throughout the state. And knowing that we only have 4.5 FTE, but 5 people in this department, what would we want to build out so that there's more opportunities for inclusion, and how does that partner up with the suspension expulsion prevention program? And really just thinking about what next, what will we do to expand this service throughout the state in different ways or in different partnerships in communities. And so cohorts, I think with the limited staff that they currently have, may not be exactly how we deliver the services, but as we start to think about how will we expand that team, or what would we do in contracts with communities to expand services like this, I think that's a great suggestion to build upon. So looking forward to all kinds of inclusion-based training and professional development and other consultation and technical assistance. Oh, and Lisa, it looked like maybe you had a question.
I do. And I think your answer kind of went down the path of my question. My question was really like, now it makes total sense that they're coming over to the ELD or to DELC. And I think that's wonderful. And I think my question is, are we going to be able to look at how this could be expanded? I mean, with the 4 or 5 FTE, I have never really felt like it was enough for the state and the work that they do. And I know that there's been a lot of different workarounds. So I was just really wanting to hear a little bit more about what are some of the plans for expanding their capacity and their capability? Also, how should we go about asking questions of inclusive partners? And then looking forward in the next, 6 to 12 months, what's the vision for what they will be doing, and how does it tie into the non-suspension expulsion work?
Okay,
So you were starting to answer the question.
So let me get this right. 2 questions, Lisa, really. Like, one is there a plan for expansion looking down the road? And 2, how should you access as a hub inclusive partners?
Yeah, yes, and then expansion or what are the plans for moving forward?
Okay, thank you.
Now I'm going to start the coughing. I was doing really good. Now I'm just trying to kick in. So to get toward answering your question, I think one of our real hopes, Lisa, was to get inclusive partners over here so we could really start to assess like what is their current reach, what is their current capability, how well is that working out, how many requests kind of are going are able to be addressed, and then what are some of those bigger asks that they just have not had capacity to support. So it's a little bit of looking under the hood and just sort of assessing first for this probably 6 months to a year, but then starting to think about what does scaling or expanding opportunities look like. And I think that can come in, and so the plan has not been solidified yet, because we wanted to kind of do the assessment, but I think there are examples of CCRNRs having subcontracts where they can do some of the inclusion activities that Inclusive Partners does in different regions. So that's sort of one way that we might consider expanding to additional regions within the state. But of course, we have to secure funding for that. I think there's also ways that we might be able to put some of our public funded, dollars to support some of our, preschool promise OPK programs also, because they're not as Inclusive Partners program is really focused on licensed, registered childcare programs. Some of those are also participating in our publicly funded programs, but usually Inclusive Partners is targeting towards childcare providers that are signed up for ERDC and accepting ERDC children. And so I think there's ways that we can expand and diversify the funding so it can support programs in different ways. I think that's another area we want to be looking at. And then just thinking about, what does this look like? Because I think having the 5 people who do the work and go out throughout the state is great, and they're doing fantastic work. But do we need to have more regionally based team members throughout the state, and what would that look like? And I think that's what we really do want to explore and figure out how to expand. And then, of course, to include, when we're thinking about inclusion and the statistics that we really do have around suspension and expulsion, even though we have laws that are to help prevent children who have disabilities from being bounced from programs or being asked to leave, our data is showing that it's double, almost triple, children with identified disabilities are asked to leave care. And so how that current team comes together with the suspension expulsion prevention program. It's just got to be fully integrated in. And so when we think about how we triage and support within regions, when requests come forward, I think how we look at expanding those inclusion services are going to be just as critical as creating some of these new opportunities like infant and early childhood mental health specialists and consultation. That's that, you can't have a program and say this one thing is the thing that's you don't say like mental health consultation is the suspension expulsion prevention program. That's one strategy. And so inclusion supports and expansion of that will be another strategy. And then there's plenty more, around professional development supports and universal supports for providers that we really need to be thinking about how we prepare them, long before they even have children in enrollment that they're needing to support, which is clearly we have plenty that are already enrolled that we want to support, but we want to also get at the front end of this as we're moving forward. So that's a long-winded answer of saying lots more work to do. And we're excited to have them on board, and we will be able to start to give you a better indication of what those strategies are as this year goes through. And the second question was, how can you contact them? I think Melinda is
yeah, it's not exactly contact, because we always work via our child care resource and referral. So that, that direct connection, I think it just sort of comes down to, my experience has been when we have needed some help and support, we can't, it's hard to get a hold of them, and or they don't have the capacity to provide the levels of support. And so I think it just sort of shows the real need. And I know that they've been contracting out and doing some different things, and that's super great and exciting. But what I'm hearing is it's going to be just status quo for right now in terms of the services that they're providing. It's just under you all now, which is wonderful. And then the next few months, we'll look for some different strategies moving forward.
Well, and I think, and to your statement, I think status quo while assessing what those needs are. So where you're saying, it didn't quite reach the need that you guys were hoping for in your region, or some requests you get, maybe access to some training, but you wanted, like, let's say begonias, you wanted cohorts. I mean, that's what we need to be hearing and understanding, so that we can build the supports beyond that. So that could be a contact through inclusive partners or directly to me. Either way, we can start to think about what is needed and what would help you most. So thanks.
All right, we have time for just one more question, and then I want to move us along. We've got a couple more things to get to. Renee, what are you wondering or thinking?
Hey there, thanks. I'm not sure I have a question as much as just underscoring what Lisa said, and then maybe at the risk of sounding like a poo-pooer or a Debbie Downer, just saying, coordinated enrollment has really shown us that providers are woefully under-resourced to support the increasing number of children who have more needs, who need more support. And I don't think it will be well received if, when we get to the point of the expulsion prevention legislation being in play, for any partner to say, we are not resourced enough to help you, but you are still mandated to serve those kids at the level that they need support from. So I think at the risk of making sure we don't put that cart before that horse, that we would do everything we can. And I mean, like the royal we, all of us within the system, to figure out how best to support programs. They're barely hanging on. I'm super curious how the RFA, what the response is going to be to the RFA, given staffing levels and morale and just all of those challenges, to be real about it. And so for providers to have all of the responsibility of that law without the adequate level of support, I think could just blow up our workforce at a time where they need, more support. So I know I'm not saying anything everyone doesn't already know, but I would really, really, really like us to somehow come together and find the funding and the expertise to be able to support our workforce before it's go time with that expansion legislation. So that's all I wanted to say. Thanks.
Thanks, Renee. And I know there wasn't necessarily a question that you wanted a response to specifically, but I think that it's important to say that that's weighing very heavy on our minds around, there's two pieces of legislation. One is sort of the soft entry to where they have to request support. And we want to make sure that we don't even have that mandate that they request support in place until we have the supports fully recognized and available. And that, again, that, as I say, is the soft entry. And then we've got the ban on suspension and expulsion completely in 2026. And so what we really want to learn from the softer version of this is they're reaching out, they're asking for supports. Are our supports working? What else do we need? How do we continue to, without consequence to providers, we want them to ask for the support they need. We want to provide the support. But the game really does change when we get to a ban, and we want to make sure that that is very well resourced. And so additional, whether it's in inclusion supports or trying to get additional supports into that suspension expulsion prevention program, because this entry that we're going into now is a great resource. There's going to be new consultants in the system, but it won't be enough. It won't meet all the needs. So we have to keep building and keep building additional strategies to support those providers. So I know you didn't ask me to respond, and I know Carmen wants to move on, but I also don't want to glaze over how important that is. So
Yeah.
I just really appreciate
I appreciate that. Yeah, it's a big deal. Thank you.
Huge. Yeah.
No, absolutely. It is a big deal, and it does weigh a lot on us, and we do spend a lot of time working on that. And it's exciting to have, again, in celebrating people being staffed up, getting staffed up to really work on that is exciting because, of course, while that legislation passed, it did not pass with the instant materialization of staff to move the work forward. So now that's where we're getting to, it's exciting to be able to dive in, and certainly working with all of you and being able to hear from you what you are understanding from community and reflecting that back to you as well is important. As well as hearing directly from providers what kind of support it is that they need and their administrators. Okay, I'm gonna move us on. Really quick follow up on the Early Learning Council cross-sector partnership presentations. Again, as Sue said, they were great presentations, and I would say and really really prompted the revisit of some conversation that's really important that Sue and I had talked about in the past, is just thinking about what it is that council members, who are the ones asking this question, can do to support our cross-sector work, including bringing agency partners to the table, keeping different sector partners at the table, defining roles for what different sectors and agencies might do in these cross-sector partnerships. I want to make sure that we give due time to that conversation. So my intention is not to work on that today, but that we would talk about that next month meeting, and that I'll send out some things to think about and to frame up that conversation, and maybe some more explicit questions for us all to think about together, because it's really important work, and exciting to have our leadership so interested and invested in iterating and scaling the work that you've done. That was one of the questions that also came up from multiple Early Learning Council members. And Sue, please feel free to jump in at any time to expand on any of this. But several members asked, and we're curious, just, how do the hubs share this information amongst themselves? And How does that work for them, and what opportunity do they have if it's between yourselves or if the ELD is facilitating that, because everyone is doing different, some similar work, but also some really unique projects, and has something, I don't even want to say has something to share. Everyone has a lot to share with others about examples of successful cross-sector partnerships. So I think that's another thing for us to think about. I would love to hear from you all in the future. And that's one of the questions I'll send out to you is what the ELD can do to facilitate that kind of peer-to-peer learning, I'll say. Yeah, and then the last piece of follow-up I'll say is that it was great collecting all the information from you, everyone who filled out the spreadsheet on just some basics of one cross-sector project that you're doing. And we went through and created some one-pagers on those. And I want to send them back out to you individually to have you, those of you who haven't seen them yet, and have you take a look and review and make sure that they're accurate. Some of what was in there was kind of complex to work through. So I just want to give you a chance to make sure that they're accurately depicting the work that you're doing. And then once we get those back, we'll do a quick proofread through with comms and then send those to Sue and Remy to get out to the council. Sue, anything else you want to add?
That's a great summary, Carmen, and I appreciate the suggestions that you've made, and I've heard it from some of you hub leaders as well. I think, like, I looked at the sector plans that were a part of the council packet, and just the work you all are doing to identify where are the needs in your regions is remarkable and super informative for the council. And it just makes me realize that as we go into the next version of Raise Up Oregon, we're really going to want to partner with you hubs in that process, and to make sure that the new Raise Up Oregon is inclusive of your work and is more reflective of what you've learned and we can learn through you. So I just want to kind of put that out there as you all continue to do sector planning and now doing these regional assessments. Know that the council is going to really be looking at the information we can gather from you in order to incorporate it in the next strategic plan. So we look at the hubs as key partners in that whole process. But thank you for the work you guys are doing. I just think it's remarkable. It's so exciting. It's just really, when we put the hub concept together 8 years ago, whenever it was, you are really manifesting, I think, a lot of the dreams that were embedded then. So thank you. And anytime you want to reach out to me, I think you've all got my email address, but just send me updates. And Kelly, I appreciated your follow-up to the council meeting. One thing the council keeps trying to focus on is, so what's the hub role in all these great projects that you're manifesting? What's the hub's part in making these projects happen? So I appreciated, Kelly, your expansion of that. But if you hub directors would keep that in mind as well, that would be really helpful as we all meet with legislative candidates and gubernatorial candidates, etc. So, thanks.
Thanks, Sue. Erin, I see your question in the chat. We used to have the collaboratives where all the hubs would get together, where there was time to share and learn. Will we start doing that again? And yes, we will. That has been on a hold as we build some capacity over here with hub coordinators. So I'm not going to promise dates on that, but I'm hoping by the end of the year that we'll be able to set up another one for that. I hear CCR, Kelly says, I hear CCR are gathering in person in October. Hubs are not invited. Are they snubbing you? No. That's exciting.
I believe that's a training opportunity
Hmm.
with Western Oregon University.
Oh,
Not
the
a,
symposium or the
yeah, yeah,
conference?
it's their annual training and engagement. And interesting that you were not invited or asked, or that you asked and you couldn't go.
Kelly, I
But
can sneak you in. You can
there-
hide
there
like
will
under
be-
my overcoat.
they are asking for more in-person meeting opportunities where we're actually engaging in planning and such. So I think that's where we would really want hubs and CCRNRs to come together, but we have not scheduled something for them to gather in person yet outside of that training.
Got you. Okay. So more to come on that. And as Sue said, we are looking for help leaders to play a role in engaging and supporting the Raise Up Oregon revision. And I've got an engagement session date with you almost settled for August. That I will try to send out to, I'll be out to by the end of this week to meet with Sue and our build partners and Remy Watts and David Mendel as well. So that's coming. Okay, next up, just take a breather here. Okay, so next up we have a partner who is new for me, who I've been really enjoying working with over the last couple of months. Want to introduce everyone to Rachel Burden, who is with us here today from OHA. Rachel is a new lead on supporting the, and Rachel, correct me if I get any of this wrong, is a new lead supporting the CCOs and implementing the new social emotional metric incentive. And Rachel, I'm going to let you in. So sorry, let me preface a little bit more. So as I think most of you, or not all of you know, the new metric does, or the new incentive has a significant community engagement piece. And one of the partners or sectors that's been identified early on, of course, is early learning. And so Rachel and her colleagues have suggested it could be really helpful to have early learning hub directors attend one of the ongoing learning collaborative meetings that the CCOs have around this metric. And so we wanted to spend some time today for you to meet Rachel, do just a quick overview of that metric to refresh people's memory, and then dive into some questions and just gather some thoughts and ideas from you to help Rachel and I and our other colleagues at OHA get ready to help facilitate that kind of joint learning collaborative on that day. So Rachel, I will let you introduce yourself and then I can start sharing some slides whenever you're ready.
Yeah, that sounds great, Carmen. Hi, can you hear me okay?
Yep.
Great. Hi, everybody. Nice to see some faces and names. And like Carmen said, my name is Rachel and I work for the Oregon Health Authority, OHA, and am newer to my role in what's called the Transformation Center, which is part of OHA's Division of Health Policy and Analytics. So like most state government, there's several layers and divisions within the Oregon Health Authority. And my particular role, I'm part of a kind of a small team within OHA that works with CCOs on what's a newer incentive metric for CCOs called the system level social and emotional health metric. And I think I understand that most of you do have a little bit of background about CCOs and about the incentive metric program and kind of how that all works. So I wasn't planning to give an overview of that, but certainly happy to answer any kind of general or basic questions about the kind of how the presentation we're going to give today specific to CCOs community engagement work on social and emotional health for kids 0 to 5. We can talk about whatever you need. And I guess the other thing I just want to say by way of connection to the really awesome and important work that you all do with young kids is long ago, before I was a nurse first in my career and then have moved on into kind of public health administration. I worked in childcare as a childcare provider. It was in my early 20s and was part of a coalition in the Midwest for fair pay for childcare providers. So I just want to put that out there and let you know that this is kind of close to my heart, and long ago remember doing the good work. So cheers to you and all of your comrades in that work. So Carmen, yeah, let me know what you want to do next. And I'm
Great. We'll just kind of tag team back and forth here. So as I was saying, we're gonna, after today, this conversation, I'm gonna meet with Rachel and we're gonna just kind of solidify our understanding of who needs to be in the room and what date is the best for them. And then our guests, I think what we're gonna do is that you'll all be invited to the August 4th Learning Collaborative that the CCOs have. And then if it isn't the 4th, it would be the 1st. So just putting those dates out there to you, and I'm gonna get a hold out to you just as quick as I can, if not the actual invite. Sorry. Yeah, Rachel, if you wanna just quick drive us through our real basics just to frame up the conversation for people. And there might be a couple people who are a little bit newer to the metric as well.
Yeah, sure. So this system level social and emotional health metric, first of all, the thing I want to say about it is that OHA developed this metric in cooperation with our partners at the Oregon Pediatric Improvement Project, which is a program within OHSU, and also with the Children's Institute. So those two non-governmental organizations were really instrumental in helping develop this incentive metric for CCOs. And as you can see on the slide here, the vision, purpose, and activities were really laid out from the beginning to have healthcare, or CCOs in this case. CCOs are the kind of insured entities that provide care to Medicaid insured families, people, and children. But really to have CCOs help change the system for how young kids and their families are cared for and how they receive services. And what we know is, maybe not unlike the childcare system, the healthcare system needs a lot of improvement before we're able to start making improvements on an individual child level. And so the metric program for CCOs is really traditionally, metrics are focused on improving population health. So really looking at kids and groups of kids or groups of people who are insured by Medicaid, improving the whole population. And we're just not at a point where we think we are able to do that in Oregon, given the system. So this metric is really focused on improving the system so that providers, CCOs, and other partners involved in care for young children can actually make those improvements. I think that we're building capacity, right? So a lot of the activities of this incentive metric are really building capacity within CCOs for how they either deliver services, set up for referral to services, and how they integrate services across multiple partners. And then really, in the end, driving, right? We're trying to drive the healthcare system towards improving child level health over several years. So the first few years of this metric are really, again, focused on getting systems in place so that we can improve child health. So I'm just going to pause there and let folks kind of look at this slide and see if there are any questions. And then we do have just, I think, going to show maybe two more slides to give you an overview of a little more detail of what's involved in the metric and what CCOs need to do. And I'm just looking at the chat. I see HealthShare will do a presentation about the metric in our region in September, which is great. Yeah, so each CCO can and hopefully is reaching out to different partners, including early learning partners, to tell them more about what this means, what this incentive metric means. CCOs have a lot of work to do themselves, and they need to do it in collaboration with a whole variety of partners, especially with early learning partners. So glad to know one of you is hearing from your CCO.
And actually at the Begonia, thank you for chiming in with that. And when I send out the follow-up to this meeting today, I'm going to send out a super quick survey that asks everyone to just name your HUD and kind of like where you are in this conversation locally. Like if you're having a presentation, have you been communicating, if you know what's out there, but you haven't touched base. So we'll be able to have that going into this next meeting.
Yeah. Okay, so this slide is really just, it's going a little deeper, showing you what there are 4 components to the CCO incentive metric. So kind of 4 different activities that the CCOs must do in this first year and really over the first 3 years of the roadmap, if you will, for this metric. And the first component is really looking at some data. And OHA has provided some data around different types of diagnoses, broad range of diagnoses, and also a broad range of services that could be considered in the kind of context of social and emotional health for kids birth to 5. So that's kind of what is part of the data that CCOs are beginning to look at, and they're looking at how, and we're the part of the learning collaborative that we're having with them is like looking at this data, making meaning of it, trying to determine what other types of data would be helpful to look at with this data that we OHA have and have provided to them. So that's the first component, is looking at data, and just want to say that kind of these 4 components I'm going to walk through, it's not a linear process, but they're all very interrelated, using data to start the process. And then the second piece is really, second component is really creating an asset map to look at what assets and gaps there are within a CCO's immediate kind of community and population they're serving. And then component 3 really is this community engagement piece. And what community engagement means in this context is engaging a whole variety of partners, early learning, pediatricians, primary care, behavioral health providers, others, community-based organizations, maybe families. And using the data, looking at assets and gaps with community input, with partner input. And then the kind of like final piece that needs to be completed is creating an action plan based on those, those other parts, looking at the data, engaging with partners, and understanding what the gaps and assets are. So I'll just pause there again and see if there's any comments or questions before we move to the last slide, where I'm going to just go another layer into what community engagement kind of pieces there are in that third component.
Rachel, there's a question. Is there a guide that the CCOs will use for the asset and gap work?
Good question. Yeah, I wouldn't call it a guide, but we OHA provide a template that CCOs can use for the asset map and gap work. There are required component or required kind of fields, if you will, that CCOs need to report on or capture as part of the gap analysis asset map, but they don't have to use our template per se. We just need to make sure that they're collecting some key pieces of information. And that, I'll just say that asset map template is posted to the OHA website, and kind of as a follow-up from this, that could be one thing that I can send you a link to the website where that's posted, and you could take a look at what's in that asset map template, so you get a sense of what OHA is asking the CCOs to collect. Great. So last piece here is really looking at over the period of the first, excuse me here, I have to move. Right, over the period of 4 years, but really the first 3 years is kind of this capacity building work that is happening. What kind of activities are the CCOs needing to do in years 1? You can see the column here. Again, those are the kind of 4 components I just went over. And in years 2 and 3, they're really repeating those same activities, because capacity building, when there's this brand new metric work, and in some cases, you know, new partners to engage with, it's not all going to happen in 1 year. I think the measure stewards, those who developed this incentive metric, knew that this is really challenging work, and, you know, coming through a pandemic and having to focus on this new work will take time. So a lot of the, you know, gap analysis, building that asset map, deepening partner engagement will need to continue through years 2 and 3. And then by year 4, again, what I mentioned early on is the intent of the metric program is really to get to what we call a child level metric, whereby CCOs will be eventually held accountable to show improvement in child health by looking at Medicaid data. But again, building towards that, because we don't quite have systems in place yet where providers can identify, screen, and refer kids and their families to services that might be needed in most places. I think that the only other thing I want to say that's not necessarily explicit on this slide is for community engagement, or Carmen, did we have one more slide after this?
Yeah, this is the last
Okay.
one. And this is the one where we were like,
Yeah.
we
Let's
want to
re-
make sure that like you all as hub directors and like the community members who are going to be engaged on this, like we are all getting on the same page about like what that engagement is, because this is something that I'll let Rachel speak to, but that is actually a requirement, as you saw in the slides, for CCOs to, that's for them to do, is to reach out in community. So we want to look at what that role could be. But sorry, go ahead. Go ahead, Rachel.
That's okay. You know, thanks, Carmen. I couldn't remember which other slide we were using, but right, this slide's just to kind of show that the community engagement component of this metric work for CCOs is really integrated with looking at data together, identifying gaps and assets within the community that help serve kids 0 to 5 and their families with social and emotional health needs. And then also creating the action plan in a specific community where there are multiple you know, sectors and entities really trying to move the needle on the health and social and emotional health of kids and their families. So again, the thing I want to say that's not explicitly on this slide that is important around the community engagement for CCOs is that there are a set of kind of required partners that must be engaged, or CCOs must engage in this work, with obviously, you know, early learning partners being one, primary care providers, or in some cases pediatricians fall into primary care, behavioral health care providers, and then tribal government and tribal partners is another required piece. I think there's, yeah, in addition to early learning partners, kind of one other group that kind of falls into that same category in terms of how it's outlined in the requirements from OHA are regional ESDs as well. So in some cases, we know that you all work very closely with or are integrated with ESDs. So I just wanted to call that out. And so that's the kind of comprehensive list of partners that CCOs must engage with. So I will pause there, and I see some comments and questions coming in. Carmen, do you think I missed anything? Is there anything else you want to add?
No, that's great. Let me get a couple questions, and then I want to make sure that we get time to get to the some questions that Rachel and I have for all of you. Does OHA see a role for Connect Oregon in this work?
Yeah, love that question. And I think a lot of CCOs are asking that same question. And I would say the short answer is eventually yes. I think having a community information exchange like Connect Oregon is one part of the system that needs to be built. It's being built in some areas more than in others. I mean, it's just more mature in some places than others, but that will be part of the system that will help support referrals from primary care providers, pediatricians, behavioral health providers to community-based services and so on.
And then one more question before we get to some engagement questions for you is, in the gap discussion, did you already have discussions or develop long-term strategies about how to build the needed workforce?
Yeah, well, I'll say two things about that. Really good question. You know, the gap discussion is right. I think it's just starting, or CCOs are in the planning phase of how to start this discussion. So it's not like discussions have happened yet. And I would say as an early learning provider, if it's the early learning workforce that needs to be part of that conversation, please raise that. And I'm guessing that the healthcare workforce is another kind of piece of workforce where there'll need to be some strategy discussions around how to support that. Yeah, the needs of that really crucial workforce. I'm not sure if that's answering your question, but it's not too late to have that be part of the conversation.
Yeah, Rachel, this is so helpful to have you here and just to give us everyone a shared sense of where we are in this process, right? That we are like really grateful to OHA and like this partnership for making sure that we are bringing in early learning to the conversation early on, right? So we can be in part of the conversation about things like the gap assessment and have input into what partners should be there with that. So you'll have these resources in the deck when I send it out. Want to get your input. So let me just start out with basics, and then we are going to kind of go back to something that Rachel just hit on, which is like, who else should be part of this conversation? But what additional information would you like to have about the metric to prepare for the meeting? And I'm going to cut and paste the questions as I have them into the chat box and stop sharing so we can all see each other. And if the answer is that you feel like you have enough information, that's also okay, but helpful to confirm or deny.
This is Lisa. Hi, Rachel. Nice to meet you. I don't know that I have a question per se. We have been very much a part of the conversations and planning for this metric to come online, which is great. We also had the great fortune of working with OPIP on another project, since we were able to leverage a lot of that data moving forward. And where we are now is doing some road shows, if you will, with various community groups to let everybody know about this metric, what's coming up. And then also from the social emotional metric, which is where all of the emphasis is really right now, being able to articulate how we want to do that and the priority populations. So that's kind of where we are right now. And I'm curious from your perspective, from what you've seen in other communities or across CCOs, if there are some things that are, I don't know, just maybe different ways to bring information, not only information, but conversation starters about what do we need this system to be. So that's one question. The second is, there are so many pieces of information that happen within early learning. We think about the DECA, we think about the ASQ SE, we think about, just all of the other pieces. Like I'm hopeful, and I don't know yet, but I'm hopeful that there's going to be some energy or synergy about how do we get that information and leverage that with our health partners, so it doesn't go either overlooked or just sort of pushed aside or what have you. So I don't know if there's anything that you would have in terms of just words of wisdoms on how to approach that.
Words of wisdom. Well, one, I don't know if I have words of wisdom yet, but I'm trying to figure out, Lisa, are you Marion Polk?
Yes, yeah, Marion Polk and Pacific Source
Okay.
is our CCO, and of course, they've got a few others as well.
Yeah.
So, yeah.
Well, so no words of wisdom yet, but I am really curious about the road shows that you're already doing in collaboration. And where my mind goes is like we're trying to have local examples of innovation and collaboration shared among the whole learning collaborative, because different things are happening in different parts of the state, which, right, I mean, I think you all hub directors know that things happen differently in different parts of the state for a whole variety of factors. So it sounds like something's happening with Pacific Source and Marion Polk Hub, and it would be great to share that maybe as part of this joint meeting. But the other thing I heard you say that, again, I think I probably just need more information. You said a few some alphabet soup there of acronyms, which we all do in our own sectors. So I don't know what acronyms you were referring to, but not to lose kind of some work that's already happening from the hub leadership level in the health, in this kind of metric work. So I would say if a CCO can, I think, leverage existing work that's happening from an early learning hub, it's going to make, it's going to make more, it's going to bring more value to the outcome that everybody's trying to drive for. I don't know if that helps, Lisa.
No, yeah, it does help, Rachel. Thank you. And I think I'll just sort of keep beating that drum, if you will, in terms of just sort of raising up this flag. There's a lot of data and information that, our early childhood providers and programs have. Like, how do we leverage that?
Yeah, and I actually just popped that question because that's one of our questions that we have for you, Lisa, and I would love to spend some time kind of hashing that out a little bit. And then Claire and Renee, I see you too. But that question of what kind of data and information do you or partners have that would be helpful to the CCO, I think is really important, because we are naming things like ages and stages and DECA and other pieces like that that are already out there that could be really informative in that assessment and then gap assessment. Let me go back to Claire and Renee, and then let's hit on this data piece too. So Claire.
Thanks. I'll try and make mine quick. So I'm in Lane County, so I have Trillium and Pacific Source both as CCOs, and they're great. We've got representatives on our governance consortium there, and they're very connected to our early learning hub, which is wonderful. But I'm curious if there are other CCOs around the state or other regions here who have or who are planning or talking with Children's Institute or OPIP around doing like some contracted technical assistance for the rollout of this metric in their region. That's something that we at our hub thought would be really helpful and beneficial, so that we can be sure we're doing this sort of with not just the letter, but the spirit of how the metric was developed and written, and also to sort of maximize the chances of this work being really impactful and potentially transformative. Our CCOs weren't super interested in that. I think they're, wanting to move nimbly and felt like that might maybe slow things down. So I'm just curious, Rachel, from your perspective, if there's any chatter about that across the state or from anyone else.
Yeah, I hear you asking about technical assistance from OPIP or the Children's Institute, and if others, or if any CCOs are using that. And OHA is not providing we're not the conduit for that type of technical assistance. So I wouldn't necessarily be privy to what CCOs are doing in terms of contracting, but I have heard, I think it could be Jackson Care Connect or All Care, one of the Southern Oregon CCOs, I believe, might be contracting with OPIP for some technical assistance, but it seems like most are not. That might change. And I think that there's a lot of potential innovation and expertise within the communities, both like CCO staff, early learning staff, healthcare staff, that technical assistance may or may not be needed. It's really going to be community specific. So that's what I know for now. And it's a little bit of a, we just like OHA wouldn't necessarily know. So maybe others on the, right, I think you did ask other early learning hubs if they have heard about technical assistance.
Has anyone else heard about that, or do you know if anyone in your hub is looking at that contracting?
Sarah added in the chat that All Care is, and All Care also serves part of our region as well, and I've heard that as well.
Thanks, Renee. Renee, you have your hand up. What are you?
Yeah, I was wondering how much local control is encouraged, expected for kind of the scope and scale of year one. And I asked that, and Sarah may have heard this as well for South Coast. But All Care's recent presentation to one of our community partner groups, they had indicated that although the healthcare sector was kind of the first sector to start with, but they had some real interest in not waiting to do the other sectors, but to kind of do the mapping of the assets and the gaps for all sectors generally at the same time, rather than to kind of segment it out or sequence it out. And I just wondered if that was encouraged, discouraged, yeah, I'll just stop there. What's allowable and what's not?
Yeah, that's a good question. What I'll say is, in terms of kind of the order of engagement with partners, that level of detail is not spelled out in the measure specifications. So I don't think OHA has kind of a, there's not a requirement at that level of detail. And so if that means local control, like that word can mean a lot of different things, then I think there is, a fair amount of autonomy for CCOs to do that engagement work in the best way they see fit, or in whatever makes sense as they are talking with the various partners. I mean, does that help, Renee?
Yeah, I can just see pros and cons of doing it that way. So I was just curious. Yeah.
Right, because I mean, there's multiple pieces from the health sector role, there's multiple pieces of the system. If you think about, right, CCOs have provider networks, meaning healthcare provider networks, who are going to be seeing kids and screening them for health conditions. And then if there's an issue, the referral piece, happens then to a whole variety of other partners. So different engagement strategies are probably needed for different partners from the CCO perspective. But I think, having shared conversations early on is going to help CCOs and their partners figure that out. Like, what's the best way to do this?
Right, totally. Thank you.
Kelly?
I like that Sarah put in the chat that she has 3 CCOs and how it's interesting to see how each are approaching it. My question has to do with how are hub directors actually interacting with the CCO? So do you have a relationship with CCO staff, with the executive director, or is it through what my experience is there's a local advisory committee council, and so it doesn't feel like our information actually get all the way up to the CCO executive level. I guess I'm not feeling heard. There are 5 hubs inside of our CCO that serves 12 counties. So I'm not sure how all 5 of us are working with the one CCO or if we're all divided and working with different advisory councils, because I think that they stopped doing the advisory councils. They're calling it an optional local health plan, local CHIP or something. Rachel, I don't know if you know what I'm talking about. I don't feel a connection. I'm not sure how to connect across 12 counties with one organization. That's my question.
Yeah, I don't know that I have an answer for you, Kelly, but I know you're from Eastern Oregon, right? The Eastern Oregon hub. Yeah, that the frontier rural part of the state is that I hear that challenge from a variety of points of view. So there are multiple hubs involved, potentially to be involved with one CCO. In a nutshell, that's the challenge. That CCO then, probably has more work to do than some others in engaging early learning partners. And if I were a CCO, I'm kind of making this up as I go. I am not the CCO, but if I were a CCO, I'd want to know, is there already a forum where all of the early learning hub partners are already are convening or connect? And how can that connection be made? And that might, well, I don't know, that might already be happening. I just, being new in my role and not knowing the landscape of CCOs in Oregon super well, I just don't have a good sense of what's happening with EOCCO.
I think that each one of our hubs, so there's 5 of us hubs that interact with the EOCCO, and each one of our hubs is different. So just like the CCO is different from the rest of the CCOs across the state, also our hubs are different, so it's a different landscape. But I see Patty's hand up, and she's also from the Eastern Oregon CCO, so she might have the magic.
Well, I have no magic, so but Kelly, I do agree with you. We at Frontier, Donna Snicker is on the LCAC, or the Local Advisory Council in Harney County, and I sit on Grant County's local advisory. And there has been a change in the structure of what those local advisory boards do. The move was made so that it could be over 51% of members. And so now maybe you're feeling the same as we are. It's kind of like we're kind of trying to redefine our role and what it is. We represented early learning in those community meetings. Linda Watson is our coordinator, and I just don't think we're all really sure where that information goes. That statement that you made, it's like we're kind of looking at, so what is our role now? And it's the CHIP, it's our community health, plans, but that's as far as I'm kind of getting. So it is different. And so we're not really sure, where we're going with it.
Thanks, Patty. I'm with Patty. It feels like we've been kind of uninvited, because it's really important to get the voice of people who are on the health plan, and that makes sense. And so the LCHIP, the community health plan meetings that have replaced the community advisory councils seem to occur to appease us, but they don't do anything with our information. So I'm not sure how to have an impact on this metric. So as this rolls out, what I need, you said, what do we need? What I need is to know who to connect with.
Hey, Kelly. So Kelly and I are on the same CCO. And I have actually had a meeting with some people from Gobi about the metric, and they're having a meeting in September. So I don't know how I got that interview, but I did talk to some people, and I can try and loop you in when I hear more information.
Would you share it with all 5 of the hubs that are involved with the CCO? It's historically, in the past, it seemed like even though it says the Dalles is the home office, it always felt like Pendleton is where people kind of convened around Gobi. And so I do think that you're closer to the heartbeat. So thank you for including us. That would really help.
Yeah, and Lourdes is on our governance board, and I'm not sure what her new title is, but I know she's kind of higher up there. So I can maybe get some more information on Monday.
I don't even know the name. That would be great.
So it sounds like we've identified a potential spot for some just like facilitation and or TA from Rachel and others that could be just looking at. So again, I'm going to send out a follow-up. It's like, hey, like which of your CCOs are you connecting with? Like what level are you working at? And maybe that can be a place where we can go through together and say, okay, here's some places where people are not as connected or not feeling. Maybe there's a connection, but it's not having the impact that they're looking for. And we can go in and do some targeted work on that together and get some facilitation from the state level. Obviously, as needed and as you're interested in, we'll reach out to you before going ahead with that. But all right, we are at time. This has been, I think, a helpful framing of the conversation to come. We've got some questions that we didn't get to, but I think that we can get to with our CCO partners in the room just as well, so we can do that. And yeah, Rachel, thank you so much for being here. It's great to have you on board with us.
Yeah, thanks for having me.
Of course. So we will get back to you with a date for a conversation with CCOs at their Learning Collaborative. I will send out slides to you as well as the recording. Let me know if you have any follow-up questions, thoughts, etc. as always. And thanks so much for being here, everyone. Have an awesome day. Talk to you soon.